Today we're going to talk about how we are different from a traditional physical therapist. So here at Manual Physical Therapy, we specialize in chronic pain and we are a physical therapy provider. So we have a lot of people calling us if they get a script from their doctor or they're just searching the nearest physical therapy clinic from where they live. Um, and a lot of times the traditional clinics are very similar. However, we want to make it a point that we are not a traditional physical therapist, that we are different because we only specialize in one part of physical therapy, which is manual physical therapy. So, to start with a whole picture, physical therapy entails so many skills. So there's an umbrella that with physical therapy, there's when you go, you do exercises, therapeutic activities, which include walking, dressing, um, modalities. They can do ultrasound, electrical stimulation, and then there's neuromuscular reeducation, which is about balance, and then there's manual therapy, and that's the only one that we focus on is manual therapy. Our clinic here is just one room with a bed and the therapist and the patient. That's it. Our treatment is a full hour, one-on-one with the therapist, and all we focus on is manual therapy, um, one muscle at a time to recalibrate their body back into symmetry. Whereas traditional physical therapy, and this is a lot of our patients have already done physical therapy, so they are more aware of that. But it's basically it's set up like a gym, so there will be exercise equipments, multiple therapists, and some have technicians. You usually see the physical therapist for the evaluation. Um, you may keep on seeing them, but a lot of times you may get a different therapist every visit. Um, and most insurances they are not one-on-one, so typically the one therapist is seeing 2 to 3 patients at the same time, so that doesn't give one-on-one care, and that's one of the reasons sometimes why they can't do any manual therapy because they just don't have any time because they have to um, work with so many people at the same time. Um, and then the other one is exercises, right? They a lot of times, even the first visit, the evaluation, you leave with a sheet of exercises. Um, but here at Manual Physical Therapy, we give you exercises until you're ready. We have to make you capable of your body doing those exercises, and the exercises that we give are meant for maintaining the changes that you have gone through our treatment, not to increase your flexibility or strength. So those are the main differences. With when people ask about how are we different, um, those are some of the ideas and examples that you'll be able to provide them.